Okay, with that much on.
It's not too bad, but it is what it is to keep everybody safe.
Right. Hello, everybody, and welcome to the Week 5, January 12th regional report out call for South Central Kansas. I'm John Rolfe. I'll be chairing this call, and we're excited to have so many with us. Now, we're going to start this call with Seth Conkle, who's been with us every week as he's been helping out Sedgwick County with their COVID response. But he is also now appointed as the special advisor to the governor of Kansas in the vaccine distribution and rollout, which the governor was able to put out her plan this week. And Seth's going to help walk us through that. We'll attach some of these slides on the website to the email that goes out from here. But Seth, let's turn it over to you to walk us through what to expect from the vaccine.
All right, perfect. Thanks, John. So yeah, we were able to roll out the vaccine plan in the last couple of days and last week, and continue to see improvements and all of the team at the state working together to make this happen. I think one of the things that we saw last week or the last couple of weeks were that Kansas was in the reported as kind of the bottom state in terms of vaccine rates. And we knew that there was a data lag behind that. And so wanted to share just some kind of definitions that over the next 6 to 8 months as vaccine rolls out, that you're going to hear a lot of, and make sure that as an individual, you kind of understand what those are. So you should be able to see my screen. And so that first one is the allocation. So that is the process of the feds determining that the state of Kansas is getting a certain amount, the state of Kansas determining that a provider is going to get a certain amount, and that process can continue. So that is at all levels of this response, the idea or the concept of allocation. So just because it's allocated does not mean that we have it in hand. And in order to get it in hand, we need that distribution process. So the first thing happens is the allocation, and then we move into the distribution, which is very simply just kind of think of an Amazon warehouse or another shipping company. When you order something, the distribution is the piece to get it to you. So again, we have to allocate first, then distribute to receive it, and finally dispensing is that act of administering the vaccine or getting it in somebody's arm. So when we report out doses administered or vaccine administered, that is the number of times a dose has gone into the total population. So from start to finish, from allocation to distribution to dispensing, there could be a fairly lengthy time frame that process, anywhere from 5 and even 8 or 9 days from the time that all happens to the time it actually stops with a person being vaccinated. So that's where definitely we're seeing some of the data delays, and we'll jump into that a little bit further. I think the one other thing that may not make sense is the idea of a pod, which is a point of dispensing. So this is just a physical location where you as a resident may go to get your vaccine. It can also be called a vaccination clinic, at a pharmacy, your doctor's office. Again, pod is a public health term, and generally it's used in the mindset of mass vaccination. So we're going to set up at this arena or the school gym, and we're going to try and do as many people in the next so many hours can, versus one-off appointments, which you would normally attribute to somebody like your doctor's office. So those, again, are just some definitions that I felt were important to share before we start jumping deeper into the vaccine phase of this response. So I think the other part of the governor's plan, and we're going to dive into that here in just a moment, would be the rollout of this website. So it is kansasvaccine.gov. Again, kansasvaccine.gov. This is going to be your one-stop shop for all of the information you need about vaccine as it relates to the state of Kansas. As you can see right now, we just talked about this, but here in the middle of the screen, we have over 84,000 doses administered. Again, those are 84,000 doses that have gone into somebody's arm. Yes, we do have doses that have been allocated to us and that we have received. Those are being dispensed every day. We also notice that there's a little bit of a lag. So this number was as of 4 o'clock on January 11th. So 4 o'clock yesterday. In many cases, the vaccine that actually happened yesterday wasn't documented into the state's database until sometime today. So we're going to continue to see that lag as we go through this. A couple of other highlights on the page. You can go here to see information about vaccine safety. You can look here for FAQs, which are updated on a regular basis. And finally, just kind of have you heard facts and fiction, or facts versus fiction about the vaccine, to help paint a clear science picture, and share case in points about data. I think the one big thing that we've all been asking, that everybody's hearing, that everybody wants to know is, where do I fall? So i.e., when can I get it? And then where will I get it? So I'm going to take you to the availability page of this website. And there's two things that we're going to quickly dive into, and then I'll turn it back over to John. So the first one is the vaccine population. This is a one-page document, good for just kind of an overview. If you haven't seen this, this is part of what was released in the governor's plan over the last week. But it talks about the 5 phases that have been identified in the state of Kansas.
Can you make that a little bigger again? Do you mind?
Oh, yep. Sorry about that. These have been the 5 phases that have been identified in the state of Kansas. They do match up with the CDC and the other federal guidelines, but we've Kansified it. So right now we are currently serving healthcare workers, residents in long-term care facilities and assisted living, and then other critical workers to the success of the pandemic. So as you can see down here at the bottom, by the end of this month, we should absolutely be able to move into phase 2, where we'll be vaccinating anybody 65 or older, anybody living in congregate care settings, high contact critical workers, and then still anybody that decided not to, wasn't able to, whatever the case may be in phase 1, we will still be allowing them to get vaccinated in phase 2. So this is just, again, an overview document. I'm going to go back to that main availability page on the kansasvaccine.gov website, and we're going to look at the overall plan to help you identify where you, your loved ones, etc., may fit into this priority and vaccine schedule. I can open it up. Oh, there we go. So you've got some kind of methodology behind how that plan works and how this plan was put together. You've got the similar graphic we just looked at it in a little bit more concise manner. And then we have definitions. So I'm going to focus right here real quick on high contact critical workers. There's 3 pieces of this that are important. The most important part of any of these pages is the definition. The definition is really defining more you as an individual, if you fit into this phase or not. You have a description which helps provide some background and some narrative around the definition, and then you have groups. You may work for a retail industry right here, but again, if you don't meet this definition, if you're working from home, working remotely, doing the books or the accounting for a retail institute, you don't meet this definition because you're not in close and consistent contact with large numbers of individuals. So these groups are really just to outline and give people a concept for who may fit into this phase. They are not all inclusive, and it really comes back to the individual and whether or not they meet this definition. So the last piece that I would offer is that if you don't meet the definition in phase 2, start looking at definitions in phase 3. If you don't meet those, continue down until phase 5, where we will be able and should have enough vaccine available to vaccinate anybody and everybody in the state of Kansas who wants one. So again, John, I know that was a high level overview. Happy to answer any questions you might have, but I think we do look forward over the coming weeks to be able to join this group again and share more information as it becomes available, because this is COVID and things continue to change.
Thank you, Seth. We appreciate that. Very proud to have a hometown guy here helping lead the state in this effort. And so we're grateful for that, Seth. And if you can make me the host again, that'd be great. And so we'll kick into the rest of our presentation, but just know there'll be a lot of this on the email that goes out following this. If you want to sign up for that email, it is covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. So let me put up our dashboard. This is where we like to start, and then we'll hear from public health and from the hospitals, just a little color on that. So let me pull this up real quick. All right, so here you can see the South Central region of the state. Obviously, it's looking like staffing is not as critical an issue, still a pretty critical issue, 17% of the hospitals, but that's eased a little bit from where we were around the holidays, and as more staff was dealing with COVID. I'm just looking at the numbers compared to where we were last week. Very similar in this area. I'm looking here. So except for one, we have more ICU capacity here in South Central Kansas as of this morning than we've had in some time, and that's good. So we had 272 patients with COVID or suspected last week. This week we're at 271. We had 86 beds, ICU beds with confirmed or suspected. We're at 88. But here's where we see the difference. There were 28 last week, or 11%. This week we're at 50 or 17%. Knowing these numbers can change and do change, that is helpful. And then coming here, as you can see, and this has gotten some of the news lately, we certainly have bounced back up to where we were in December with this 5,300-ish a second week in a row. Not where we were here at the peak of 7,000 and 6,700, but we do not want to get back to that. We had last week a 13.8% positivity rate by the KDHE measures, which is the second highest in the state. And so just really want to make sure that we're staying cautious and on top of things. So let me, with that information, here's a look at the second page. Again, this dashboard is attached, also available, attached to the email and also available on the website. But I will now kick it over to Seth again to give us an update from public health. Seth.
Well, I think that graphic paints a picture of what we're seeing. We're seeing continued increase in tests. The hospitals, I'm sure, are continuing to see an influx of patients, and definitely not going the correct direction, or the direction we want it to go. So I think that the news in public health, for the most part, has been around the vaccine. So I don't want to take much more time covering that, since I've already covered it from my perspective. But I think when we talk about that from a public health perspective, or talk about vaccine from a public health perspective, it's not an be all until we can get a lot more people vaccinated. So it does not mean you can stop wearing masks, can stop social distancing, can stop washing your hands. So it's going to have to continue again until we get later into the year, where we've had a lot more people vaccinated. And if we don't follow those precautions, we will continue to see that number, along with probably, I would venture to guess, our death rate increase as well.
Yep. Thank you, Stefan. Just locally, so each part of the vaccine plans, each county then dictates inside of those subgroups how to prioritize and how to administer through pods and like that. I assume it's too early really for Sedgwick County or any of the counties that you work with to know what that looks like, but that's something we can probably look forward to in the future. That'd be right.
Yeah, I think definitely. I think what I'll do is I'll work to give us some local public health partners, maybe from a couple different counties, that we can have join the call in the future, to share kind of, Sedgwick County more of an urban, as much as Kansas has urban, versus more of a rural setting, and just share kind of different ways that they're addressing the vaccine. I think it's ultimately important. The most important thing when it comes to vaccine is to trust and look for information from your local health department of all of the counties in South Central Kansas. Don't just pay attention to what they're saying out of Wichita and the Wichita media. Look at the information from your local county as to who they're currently serving, when they're having their clinics open, and or who are those other providers in your county that are offering COVID vaccine when it does become more widely available as phase 2 comes into play.
Thank you, Seth. Now let me pass it over to Dee Dee. Dee Dee, if you can introduce yourself and
Yes.
give a hospital perspective, introduce our guests.
Thanks, John. I'm Dee Dee Duell. I work for Ascension Via Christi, and my role here is basically outreach. And I oversee a rural health network, critical access hospitals, of 9 of those here. And in this role, and for the purposes of these report outs, I'm representing 19 counties and 31 hospitals. As it relates to back to the dashboard numbers from a hospital perspective, I really don't have too much to add to what John and Seth have already noted. We do have to still remain very vigilant in our practices. You know, while some hospitals may not be seeing an increase necessarily in hospitalizations, they're still seeing an increase in cases, you know, so we have to stay on top of our game here. I know here locally, I can speak from Ascension Via Christi, we've actually had a little bit of a decline in our hospitalizations. And we're just hoping that continues, because that, you know, we're seeing, you know, a drop from what we had seen in November. And that's great because it's allowing us more time for us to get our staff vaccinated. We still have quite a high demand for ICU beds, and that's happening in most areas. So we're remaining, you know, we've seen, I feel like maybe there's a little bit of the breathing room in some of the ICU capacity, but still in high demand everywhere, I think. Staffing seems to be a little bit stable, which is really great to see. But I think what I've been hearing in our past report outs is just a whole lot about staffing morale and emotional health. And I think that's something we really, really need to stay on top of these days, is what this long haul is doing to our healthcare providers over this period of time, and the struggles that they may be enduring, and really be cognizant of that. I know a lot of the hospitals are doing lots of different things to keep their staff motivated, providing extra things for them to try to support them socially and emotionally. I know here, for instance, we've just created a wellness room where staff can go take a break in a really relaxing, calm setting. Take a break there. I know lots of the hospitals are doing many things to support their staff, and communities are doing great things to help support their healthcare workers. You know, one other thing we try to do here is provide some behavioral health, trying to think of how could we get some kind of behavioral health tools out to our Kansas hospitals. And so our behavioral health leaders put together kind of just a lunch hour, you know, 1 hour lunch hour, kind of a education session sort of, and we launched that out to all of our Kansas hospitals as a way for them to kind of tune in and maybe get some tools and some help on how to identify struggles, how to identify not just, you know, in our patients, but also in our own staff, how to be more aware of that, and to try to get some tools and resources available for them to help and support where needed. So I think all of those points actually can be further expanded on by our next speaker. John, do you have any other points or questions?
No, go for it. Pass it on.
Yeah, today I was really happy to have joining us Jennifer Owen. She's a nurse from William Newton Hospital in Winfield, and she's been working on their COVID unit and working with those patients, I think, since the beginning. And I'm sure, Jennifer, you can probably give a nod and expand on all those points I just mentioned on staffing and those sorts of things. So Jennifer, I'll turn it over to you.
All right. Well, thank you, Dee Dee. Again, my name is Jennifer Owen, and I'm employed with William Newton Hospital, and I've been here for over 13 years now. And this is my first pandemic that I've ever had to experience, and I'd rather do it here than any other place. Really feels like home here to me. The type of patients that we've been seeing here have been more moderate type situations. The severity of it is more if the patient needs oxygen, and also the plan of treatment that we do for them. The length of stay has been longer than usual. than what we're used to, but we get to know the patients, and I think it means a lot to them that they kind of see the same faces day in, day out, even though they see this. and so as far as severity, I mean, if they get too severe, I know we ship them up to you guys or wherever there's an opening for a higher level of care. So as far as our cases here, again, it's just more moderate. And so a lot of times the patients will go home, but then again, we have patients that they have so many comorbidities that they can't survive. And so they make that decision to go on comfort care. And, and it's really tough for the families because they can't be here. They can't hold their hand. And it's really hard for us as nurses sometimes to tell the families that, we're sorry, you can't. So there's one time that I know on a patient, family couldn't come see him. The daughter kept calling, the wife kept calling. And I asked them if they had an iPhone and if they wanted me to FaceTime. And so they agreed to that. And so even though the patient was unconscious, again, comfort care, when he heard his wife's voice, I mean, he raised his eyebrows just like what you did, Dee Dee. And that was, I told the wife, I said, he just raised his eyebrows and that they knew that he could still hear them and they could sit there and say their goodbyes. And, that's the best that I could do with the situation. And so that was, something that I felt that I could at least give the family some closure of not being able to say, they could say goodbye and feel at peace with that. So another situation, I've had a gentleman that was in his 30s and he wasn't doing so good. And, and he even told me, I'm scared. And, and I told him I'm scared for him too. And that I would, pray for him. You got to do what you have to for these patients to give them some hope and let them know that you're on their side and you're fighting for them. And unfortunately, this man did pass. I mean, and so it's heartbreaking to find out that someone that you fought so hard for ended up, did pass. And it's really, I mean, hard on us nurses. And so, you talk about the emotional and mental part that, we deal with. This is a whole new level for nurses. And so, yeah, I agree that, it's great that, our administration has stepped up and has been really comforting and giving us, always asking us if we need anything. Meals always being provided. I mean, it's a wonderful thing. They let us wear t-shirts. And so it makes it nice. I mean, we could do little things different, but I know it's a tough situation. It's all new and all we can do is, depend on the researchers doing their research and the plan of care may change. I mean, by next week, we might be doing something different because research has shown another, evidence-based situation that works better than what we're currently doing. So, I mean, it's all a learning process. Every week's a learning. So another thing I do with my patients is, since they can't see out, I mean, we had to convert our medical surgical floor, one part of it, into basically an isolation unit. And so we converted 8 rooms with the negative pressure HVAC systems for the negative flow pressure. And of course, the windows had to be taken out. I mean, so there's plywood. So there is no light. I mean, they can't see outside. So I would go and take pictures of the outside for them and show them on my phone to say, hey, this is, especially the ones that couldn't get out of bed and make it to the door to look down the hallway to see the outside. So it's the little things that I think our patients appreciate from us. So, and I think I could probably ramble on forever about the different things that we do, and I truly appreciate everybody wanting me to speak on behalf of William Newton Hospital and what we're doing for our community and hoping we can get past this pandemic and get on with our lives. So I really appreciate you guys having me.
Thank you, Jennifer. And I bet they appreciate the cats and the yarn on your headscarf there.
Yes.
I do. Brings a smile. But I'll tell you, one of the things I've really learned just hearing wonderful human beings like yourself is, there really is an emotional investment. It's what anybody would want for their loved one, for the people giving them care, to emotionally invest in them and to give of themselves like that. And then you lose someone who you've poured into that person is rolled out and another person is rolled in, and you have to do it all over again. And so the fatigue that I'm hearing from you all and understanding, I'm so inspired personally just to see you all stepping up over and over again to give of yourselves to try and pull the best out of the people that you're serving there in your COVID unit. So thank you for being you and being human and bringing love and kindness into the world that way.
Thank you.
Real important for all of us to hear these stories. So thank you for giving of your time to be with us too. Dee Dee, anything you'd want to add?
I just wanted to say thank you, Jennifer. I really appreciate it so much.
You're welcome.
Jennifer Owen out of Winfield. Grateful to have you here with us. And, and wrap up, we'll be here at the same time. Sorry, I'm going to get the view back to the gallery here. We'll be here at the same time next week. South Central Kansas is at 1:30 every Tuesday. You can sign up for the email at covid.ks.gov/report-outs. covid.ks.gov/report-outs. We'll have some of the stuff that Seth shared with you. We'll have the dashboard on there. And we'll just keep you up to date as these things change. Obviously the numbers still going up in certain areas. The hospital's having a chance it's still manageable for them, but we need to be careful and stay on it. Two quick bright spots. I mean, I don't really know that you need anything besides Jennifer, but Hutch Regional Hospital being recognized nationally for their work with some of the antibody treatments that are out there. So Hutch Regional Medical Center, just great story on them if you haven't seen that. And then also as the nursing residents are going out, they highlighted a wonderful lady who's 101 years old, Virginia Garver, who received her COVID vaccine at Larkfield Place this week. And she's a polio survivor from when she was a kid. So I like what she said. I'm not reluctant at all. I don't think the government would release the vaccine if it weren't safe. So she's a former RN, Jennifer, so of the same ilk there. All right, everybody, thank you for being on today. Jennifer, thanks for everything, Dee Dee.